Hello, and welcome to Invitation to a Conversation. I'm Pamela Bailey. My guest today is LaTanya Abbott-Austin. LaTanya Abbott-Austin is a proud member of Brunswick, Georgia community. She has extensive expertise in nonprofit services, entrepreneurship, sales and marketing, and community development. Most notably, LaTanya is the president of the Robert S. Abbott Race Unity Institute and a direct descendant of the illustrious Abbott family. She is the mother of 4 wonderful children and grandmother to 6 beautiful grandchildren. When LaTanya is not working her full-time job in community outreach and engagement, you can find her being an extraordinary life coach and traveling all across the globe. Can I travel with you?
Yes, you can tell that was written pre-COVID.
Yes. Well, good evening and thank you. I'm having you on because I think COVID is still relevant in our community, and we would just like to discuss some questions, get some answers into the community of where we're at and what's going on.
Okay.
What interests you to get into the medical field?
Well, I've always been a lover of people, and my first love was psychology. But when I went to Brunswick Junior College back in 1978, I let them talk me out of it because it was over infiltrated at that time, they said. So then I chose radiology technology. And so I worked as a radiologist, x-ray tech for probably about a year. And then they closed the little health center that I was working at the time. And that was way back in my 20s. So after learning what an FQHC is, a federally qualified health center, that is so weird because it was the same type of health center that I'm presently working for, Coastal Community Health Services. And it's like God took me full circle. You know, I was doing x-ray and lab technician out there. And then after they closed the health center down, we had lost the federal funding. Then I came back to Brunswick and I went into retail sales and then retail management. And then one of my customers taught me into trying insurance. So I was an insurance agent for like 15 years. And then I started doing Mary Kay because I had been with my clients so long. I saw their children grow up, saw them go to college, get married, and then I started losing a lot of them. And I was so emotionally attached to them. I was getting really depressed. And when I started selling Mary Kay, it was fun. You know, it was girls' night, make everybody pretty, make everybody feel good. And so I ended up leaving insurance to conquer my Mary Kay career full force. I made directorship and all that good stuff and worked as a manager in a couple other positions in business. And now I'm back at a federally qualified health center. So I guess this is it, this full circle. But I've always worked with people. I always like solving problems and helping people live their best life. So.
What is COVID-19 and Delta variant? Is there any similarities or differences between them?
There is. The COVID-19 virus is a coronavirus. And a lot of people they have a lot of skepticism about the vaccines because they think that they developed it too soon. But actually the coronavirus, there's several coronaviruses that we deal with every day. The common cold is a coronavirus, it's caused by a coronavirus. And so they named it coronavirus 19, but the official name was SARS-2 COVID SARS-2. And then they called it novel because it had characteristics that they hadn't seen before. But and the Delta variant it started as a COVID-19, and then it mutated itself. Every time, not every single time, there's thousands of mutations, and some of them aren't successful. But what happens is the virus will mutate itself, like change the structure of its genomes to survive, basically. And that's what that Delta variant is. It's a stronger, easier to catch, easier to transmit, more aggressive coronavirus, COVID virus.
How do we manage ourselves on a daily basis to prevent from getting COVID or Delta variant?
Okay, the tried and true. If we cover our face, wear face masks that fit snug, sometimes two layers may be necessary. If you're in a bigger group or an inside meeting or association that you know there's a lot of people and you don't know who in there is positive, two masks are advised, or either the KN95 mask, because it fits tighter around your nose and your face, so it keeps more particles out of your respiratory system. And then the social distancing is still advised, and hand washing, and just being more conscious of interactions with people. They say that you don't have to, if you're vaccinated, if you're fully vaccinated, you don't have to wear a mask outside. But I still wear my mask outside since they, changed back.
And the proper wearing of the mask is to cover your nose, because that is the entrance level of the virus. I see a lot of people wearing their mask, but they have it below their nose.
That drives me nuts, because they really think they're really protecting themselves and they're inhaling all kinds of particles that they have no idea. Yeah, the entry, one of the big entryways is through our nasal, another's through the mouth. That's why we cover the mouth. And I have even heard cases of people absorbing it in their eyes, like they'd be all masked up in all the protective gear, and the only thing that was showing was open were their eyes. And so there's been a couple cases where people actually caught it through their eyes.
And is it worse if they catch it through their eyes, milder, or what is the symptoms like?
I haven't seen any studies to say whether or not it's milder. It depends on the variant, more so to how sick you would get. And this one has like 10 times the amount of virus when you catch it than the first COVID did. COVID-19, the original COVID-19 did.
This is
ma'am?
This is the $1 million question. How safe is the vaccine?
Okay. I've been vaccinated. I've had both vaccines. And most of my coworkers have both vaccines, and we're still living. I truly believe that the vaccines are safe. It is true that they're new, so they may not know all of the long-term effects of the vaccine. But in my heart, I truly feel like the side effects from taking the vaccine are way, way less than taking a chance on catching COVID and dying. There's been over 700,000 people in the United States have died from this one virus. And to my knowledge, there hasn't been anybody that died from taking the vaccine. Now, I will say that there have been a few instances where people died after they were vaccinated, but they had underlying conditions. The underlying conditions is what they died from, not the vaccine.
What are the symptoms for COVID and the Delta variant?
Okay, the symptoms of COVID, and I have notes here. Oh, excuse me, I've got allergies too. Where's my notes? The symptoms for the COVID-19 and the Delta variant are somewhat different. Both of them have wide ranges, both from mild to severe. Now with the COVID-19, you can have a cough, shortness of breath, difficulty breathing, fever, chills, muscle aches and body aches, even vomiting and diarrhea in some people. And then the tall tale sign is when you lose your taste and smell. That's with the original COVID-19. And now with the Delta variant, they're more like cold symptoms. You know, you can have a stuffy nose, you can have a headache, you can just feel like you're catching a cold.
So when you
Goes
go
from there.
so when you go to the doctors and you're feeling certain symptoms, the doctor will tell you whether it's the Delta variant or the COVID-19?
Not just a regular primary care doctor's office, or even some hospitals will know which the difference is. The lab, whenever we take the PCR test that they put in your nose and we send it off to the lab, they can tell there because they can look at the genomes. They have to actually look at the specific genes in the virus to tell which variant it is. And we've been doing this for about a year and a half, since maybe February or March. But everybody that comes in our office, we take their temperature and we ask them a series of questions, as well as our schedulers ask the whole series of questions. Do you feel sick? Have you been exposed to anybody that has COVID? And then have you been out of the country? You know, there's a whole series of questions that they ask anybody, and everybody is assumed to have it until proven not, if they have any of those symptoms. Yes, ma'am.
Can you get COVID or Delta variant from your clothes or surfaces or shoes?
Mm-hmm. Okay, so when you see people on TV that they have the hat, the mask, the face shield, the gown all covered up, even shoe covers, they do that to keep the virus off of their clothes as much as possible. So when they get it off from work or wherever, they take that all off and they throw it in the trash. When they get home, they take all their clothes off and put it directly into the washer, because the virus can attach itself to your clothes and it doesn't get in through your body, through your clothes. But then what do? We touch ourselves and then we rub our eyes, rub our nose. So that's how it gets in, through your open.
Okay, how does COVID after being vaccinated differ from not being vaccinated?
Okay, all evidence shows that people that have been fully vaccinated have a much milder case of COVID than people that are unvaccinated. Let's see something. I'll show you this too. Okay, I printed off today's report from the hospital here in Brunswick. They post the report every day. And for an example, right now, as of today, there are 3 people in our hospital here that are aged 12 to 19. Okay, that's not the point I was gonna make. I'm sorry, I'll bring that up a little bit later. But on the Camden campus, non-ICU patients, they only have 2 vaccinated, but they have 9 in ICU that were not vaccinated. On the Brunswick campus, there's 85 non-vaccinated patients. Out of that 85, 15 of them are vaccinated and 52 were unvaccinated. You see the difference?
Yes. Yes.
Yeah.
It's still higher in the non-vaccinated.
It's always, yes. In every hospital, every report I've seen, it's always higher. The vaccines are 96% effective. Okay, so what that means is out of 100 people, 6 people have a chance to catch it again, to catch the virus, even vaccinated. And when you have millions and millions of people, you know, the number may look large, but it's a small percentage. It's less than like 1% of the entire population. I saw something today too that about how many, and I probably can't put my hands on it, how many hospital visits were saved so far. Let's see where it is.
What does the homeless population look like? I heard in a conversation that some of the patients are homeless people that have the COVID.
Okay. COVID does not discriminate between homeless or not. There may appear to be more homeless people at different times because they congregate together. They go to day facilities together. They sleep like at the Salvation Army and stuff. And honestly, there is an outbreak, but there's an outbreak in just about every business. They shut the schools down because it was code red. They had so many positive cases in the students and the teachers. So yeah.
What people are saying that taking zinc, vitamin C, and vitamin D is a prevention from getting COVID. Is that true or false?
Well, I'll say it's kind of true because taking zinc, vitamin C, and vitamin D are good for our immune systems. And so when we strengthen our immune systems, we do protect ourselves from several different kinds of colds. And just like last year with everybody wearing the masks, the flu season almost didn't happen. I mean, there was just very few cases of flu in the United States last year. So taking those vitamins will help your immune system. And if you already have the virus, it'll help you get better faster.
Okay.
But they prevent it. Yeah.
And the skepticism in the Black community about not being vaccinated compared to the Tuskegee experiment.
Yes, ma'am. Well, I know that African-American people, our people, have a lot of mistrust for different medical practices and tests that were run on them without permission, basically. But one of the differences in the Tuskegee experiment is that they were withholding treatment. They injected the people with the syphilis, and then they withheld treatment just to see how it progressed. And with this virus, they're offering the treatment to keep all of us from dying, basically. In the African-American community, from the research that I've seen, it looks like there's more death per capita in the African-American and the brown communities because we have more underlying ailments like high blood pressure, diabetes, obesity. All of those things put a stress on your body. So when your body's already stressed, then you're weakened. And when you're weakened, then that makes you more susceptible to a more serious case.
You just answered my next question.
Oh, sorry.
My next question, that's fine, was what was one of the health condition that's more susceptible to the COVID or Delta variant?
Yes, ma'am. Any chronic condition, even like COPD, lung cancer, breast cancer, kidney trouble, just any kind. At first, they were talking mostly about the lungs, respiratory system, but it has been shown that COVID affects every organ in our bodies in one way or another one. So even high blood pressure is a serious threat. Anything chronic that you have to be treated for or take medicine for. And the saddest part about it is some people don't know they have it,
And after they heal from COVID, will those organs repair themselves? Do they have a chance of repairing themselves?
That is a very good question. And that's one that they're studying now, because they've studied, let's see how long they did. I think they studied about a year, no, maybe not even a year, maybe about 8 or 9 months with the vaccine. So that's an answer that I'll get back to you on.
Okay. When COVID first came out, it was said to be just targeting older adults, then middle-aged adults. Now we're told to vaccinate children 12 years old and the 20-something adults.
Yes.
Will we have to vaccinate 11-year-olds and younger?
I believe so. Pfizer right now is testing their vaccine on children younger than 12. Pfizer just received the full approval from the CDC last week for 16 years and up. So they're still working out the different dosage amounts and the different various concerns for children under 12. But yes, I believe there's going to soon be a vaccine for everybody. And the scariest part about this Delta virus, at first it was only older people and people with chronic ailments that were getting sick. Right now with this Delta variant, it's almost half and half of people under the age of 30 that are coming down with it, because it's mutated itself to where it's easier to transmit from one person to another, and it's meaner. The virus is stronger. And I saw a study the other day that was interesting. They were saying that if a vaccinated person and an unvaccinated person are both infected, they can have the exact same amount of virus in their system when they swab their nose. And the vaccinated person won't get as sick as the unvaccinated person. But the sad part is you could even give it to someone else that's not vaccinated. So that's another way that it's spreading and mutating itself.
And I read recently there was a survey through the U.S. Census where a Dr. Guest from Emory University, she's a chair of epidemiology, and she was saying that, and she was talking only about Georgians. And the census stated that 60% of people in Georgia who are vaccinated hesitant, don't trust that the vaccine works. Then it says at least 57% say they're concerned about the side effects. Are they side effects? And if they are side effects, do people who have COVID are on medication for the rest of their life or temporarily?
Yeah, okay, that's a very good question. The people that are vaccine hesitant, the ones that most of the studies that I've seen or people I've talked to, they don't trust it because they don't think there was enough study done. And so they don't believe the vaccine is effective. But, and a lot of people have misconceptions. I have this little frequently asked questions sheet that is amazing that was sent to us from the Georgia Primary Care Association. And a lot of people have heard all these different things. The vaccine does not, one of the biggest myths is that the vaccine keeps you from giving it to somebody else. The vaccine doesn't. The vaccine protects the person that was vaccinated. Unfortunately, you can still give the virus to other people. That's one reason why they want a certain amount, a certain percentage in an area to be vaccinated so we can get herd immunity. Because if there's enough people vaccinated, then the virus won't have any place to go.
So if you're vaccinated, I'm vaccinated, you're vaccinated, yes, we can still give the virus to somebody else?
Only if I may not have explained that right. Only if you get reinfected. Out of that 100 people, those 6 people pick it back up. Yes, ma'am. So that's why it's important for everybody that can be vaccinated to be vaccinated, because then they don't spread as much.
And from this survey, another 50% say they don't believe they need a vaccine. What do you say to people like that?
I say, well, aren't you watching the news? I mean, there's over 600,000 people that died, and I would say half of them were healthy people. I mean, we've had, all kinds of bodybuilders, doctors, nurses, people that are healthy. And that virus just gets in and just attacks some people. And I really, truly believe that the people that had a really bad case and that did die from it may have had, the younger people that were healthy may have had a pre-existing illness and didn't know it.
And one of the suggestions she made was that maybe some of those people have recovered from COVID and are relying on their own natural immune system to stay healthy.
And I've had people tell me that too. Well, I already had COVID, but COVID, the antibodies only stay in your body for a limited time. I haven't read yet exactly how long because they're still studying it. But the vaccines they're studying, Pfizer and the Moderna, seem to stay in our bodies and the immunity starts waning right about 6 months. So that's why they're talking about us getting a booster shot or a third vaccine. because the immunity starts waning after 6 months.
After 6 months that you've been vaccinated?
After 6 months of your last vaccination. Yes,
Right.
ma'am.
Right. And the last data, she's on the last information she gave in the data says that even if you had a natural COVID infection, you might have some antibodies, but they don't offer the same protection as the vaccine does.
Exactly.
So
they don't. The vaccine's protection gives you a higher rate of immunity. And the antibodies, it's just not enough known about the antibodies to guarantee that how long they'll last. You do have some antibodies. And when I caught COVID the weekend after Christmas last year, and I called the CDC and I was asking them all kinds of questions. And one of the statistics they had at that time is they said they had never had anybody to catch it twice within 6 months. No, yeah, 6 months, 6 months. And right after that, I mean, literally a month after that, I know a girl that caught it twice and we diagnosed her both times. But what that difference is the variants. There's variants around. So you may have had one variant, but you haven't had another. The great news right now is that the current vaccine does work on lessening the severity even of the Delta variant. So that's good news.
Okay, you mentioned a short while ago about the booster shot now.
Yes, ma'am.
So what is the difference between the booster shot and the vaccine?
Okay, that's a very good question. I'm glad you asked. Okay, everybody that takes the Moderna or the Pfizer vaccine has to have 2 doses, one at 3 weeks and another at 4 weeks before they're fully immune, okay, fully vaccinated. So for healthy people or semi-healthy people, that's enough. But then I told you since then they've been researching and they see that the antibodies wane after 6 months. So they're advising a booster shot, which is the same as a vaccine, at 8 months after your second dose. 8 months after your second dose is when they authorize the booster. Now, there's 2 different types of third doses. The booster is what people with the strong immune system would take. But then for people that have really serious chronic conditions, they need to have 3 vaccines and then have a booster 8 months after the 3rd vaccine, because their antibodies aren't going to be as strong as a healthier person with a stronger immune system.
So is there going to be a problem if everybody is not into getting the booster shot? Because going back to when COVID first came out, like I said, first they said it was only to a certain demographic of age people. And now it's trickling down to our children. So what makes them believe that now that they took both of the shots, like they were said to, now they have to take this booster? So will this booster shot be the final shot? Or is this something, because one of the myths they're saying is that we might have to take a shot every year, a booster shot every year.
Yep, and that one may not be a myth. And I'm not trying to be funny, but this is a novel virus. So the longer they study it, the more they learn about it. And at the first, they said the first 2 doses, now they've studied the people that have had the first 2 doses long enough to see that the immunity wanes, that we're going to need a booster shot. I'm really thinking that, I don't want to put it in the atmosphere, but I really feel like this might be like the flu shot. You know how you have to have a different flu shot every year? I'm almost thinking, because my CEO said this a little while ago, this is our new normal. And I'm like, no, I thought it would be over by now. I was hoping it would be over and everything had calmed down. And then all of a sudden that Delta variant made its way from India here and started the rage all over again. But yeah.
So up to date, what is the actual number of deaths in Brunswick and Glenn County from COVID?
Okay, let's
see. Since we thought we were in post-COVID and now it's rising again.
Oh, okay. So I don't have it exactly that way. Let's see, the coastal health district counties, which is Bryan, Camden, Chatham, Effingham, Glenn, Liberty, and Long and McIntosh. The total number of positive cases was 62,863. And where's the deaths? The deaths was on here. And out of those, it's been 19,086 deaths.
In all of Glenn County and Brunswick.
No, that's all those counties I named.
Yes, it's a total combination of all those counties.
Of all those counties, because that's the health districts district, our health districts district. So they clump them all together. In Glenn County alone, it's 10,943. Dang, that is,
Is that 10,000 deaths?
No, I'm sorry. That's 10,000 positive cases. The deaths for everybody is 1.8%, which is 19,086.
Okay.
I was gonna panic attack.
Well, you know that a couple of weekends ago, Brunswick heard that we got in a portable morgue that just sent everybody feelings into a different type of space. Is that morgue still here? Are the numbers going down?
It looks like the numbers may have slightly gone down from last week, but I am happy to say that the vaccination percentage is rising, because we were at 39% before this Delta variant raised its ugly head, and we're as a county up to 43.4 right now. Camden County was at 28%, and they're up to 32.6% right now. So I can't really say that it's going down. The new cases last week did go down, but we had deaths also. So
it was the youngest child, 6 years old, that had COVID here in Glenn County, that transition.
I believe so. I saw a news article a couple of days ago that this newborn baby is in the hospital, tested positive, fighting COVID now. So it's, it's younger and younger. It's crazy.
Is the portable morgue still here?
Yeah, as far as I know, it is. I have not heard that it moved. And they also called in the National Guard to help. Because the hospital is shorthanded due to sickness, and for parents that have to be out of work to take care of their children that are at home on virtual learning now.
So we're dealing with COVID-19. We're dealing with the Delta variant. Now we have the West Nile virus. Was the West Nile virus in Glenn County last year, or is this something new?
You know what? I think I did hear about it being here last year, but they just discovered it again this week here in a mosquito down, I want to say downtown somewhere.
So what is the symptom? Are you aware of the symptoms of someone having been bitten by the West Nile virus, by the mosquito that had West Nile virus?
I'm not really familiar with it. I know that you probably feel like you're real tired and sluggish and achy, like you're catching something. Yeah, but it doesn't hurt to check everything out these days.
Okay. Miss Abbott-Austin, who inspires you?
Actually, I think more than anybody else, my children and my grandchildren inspire me. Just seeing how well they have turned out and what passionate parents they are. And then my little grandchildren just make me happy. So they're my inspiration.
Do you have a favorite scripture, phrase, or testimony that keeps you grounded?
I do. The joy of the Lord is my strength. That's Nehemiah 8:10. And I count on that. So I try to stay joyous and count on him for the strength. And sometimes we don't realize how strong we are till we have no choice.
Say it again. Say it
Yeah.
again.
Sometimes we don't know how strong we are till we have no other choice but
Yes.
to stand. Mhm.
Yes. What words of wisdom would you like to leave the listening and viewing audience?
Whew, I would like to leave, if we're talking about COVID, I would say, please think about getting a vaccine. And I heard an analogy the other day that I thought was really good. This doctor was saying that look at the vaccine like a car safety belt, a seat belt. We put that on every time we get in the car, hoping that we won't get into an accident, but trusting that if we do, that seatbelt will help us. So look at the vaccine the same way. You don't want to catch the virus. You don't feel like you'll catch the virus, but go ahead and take the vaccine as your safety belt and just, hope that you don't, and just follow the instructions. Follow the masking guidelines, follow the washing your hands, and the social distancing, because that's what's going to keep us safe, I believe, right now.
Thank you so much for your various facets of serving people all over, wherever you have been. Are you a native of Brunswick, Georgia?
That's a good question. Some people assume that I am. My genes are native to Glenn County because my father's family was born up and raised on St. Simon's Island. So when my dad grew up and went off to the military, when he retired, he brought us back here, back when I was in 9th grade. So I went through 9th grade all the way through high school and the Brunswick College here. And then I married the military myself and moved away. And now I'm back. So I consider myself local. My genes are local.
Thank you so very much for accepting my invitation to a conversation. I think it was very informative. I hope a lot of people adhere to the information that you have given, and hopefully they will feel more safer in getting the vaccine than they were before they heard this conversation.
I hope so. And by the way, before we leave, I want to give an announcement. We're going to have a mobile clinic this Friday from 9 to 2 at Lady K's Kitchen on Altama. I believe it's 4419 Altama Avenue, right next door to Enterprise Rental Car. And it's free. If they want to come and have the vaccine, they're welcome. Walk-ins are welcome. Walk-ups are welcome. Or if they just have questions and want to ask questions, they're welcome to come and do that as well.
Thank you. And you continue to have a blessed week. And everyone out there listening or viewing us, continue to have a blessed week. And I'll see you soon.
Blessings back to you. Thank you, Pamela.
Thank you. Have a blessed evening.
You too. Thank you.